We were in a really dark place, I think, 3 years ago. Finances weren't right, staff engagement, morale wasn't particularly very good. Patient staff involvement was really poor, and the CQC report wasn't good. So we had a good platform to start with, but I think with co-production, with staff engagement and the fantastic staff that we've got in the organisation, we just started on a real continuous service improvement journey.
I think we needed to sort of first look at ourselves and really understand what the CQC had been telling us, what our staff survey was telling us, take that information to put it together and come up with a plan to how we were going to improve our services and improve the quality and experience, not just for staff, but actually also for carers and service users. So it was about using the data and thinking, what do we need to do differently? How are we going to do it differently?
They do their best with what they're given, and they learn, they care, and they're still growing to inspire the staff within the Trust from top to bottom. Special mention to the staff, they are the nucleus of the Trust, and without their efforts and without their care and understanding, people like myself wouldn't be on the good path that I am now.
Winning the HSJ Mental Health Provider of the Year has really affected teams in a positive way. All staff very, very proud to have won such a prestigious award. Ultimately, you can see staff morale is, it's fantastic.
It's absolutely fabulous that the Humber Foundation Trust has been recognised as the Mental Health Trust of the Year. It's a real credit to the hard work that the Trust as a whole does, the families, the young people, the adults that we work with, all contributing towards really developing and delivering an award-winning service.
I don't think we thought we were going to win it, but we thought it was just an interesting process to see how we'd rate ourselves against some other great trusts that have won the awards in previous years.
And myself, as someone that works within the trust, is really reassuring, and also someone who is a client, I think it's really reassuring for them as well, because it really highlights and proves that what we're doing it really well, we're doing it effectively, and it's working across, and it's really been fantastic to be a part of that.
I'm a nurse by background, I've always been proud of the NHS, but I'm really, really proud of this organisation.
In difficult times, it's very easy for the NHS to beat itself up. And entering wards gives teams and individuals the opportunity to celebrate the success, and all the evidence would show that organisations that take time to celebrate success tend to have better outcomes than those organisations that don't.
Would I encourage others just to come into the award? Absolutely. And I wouldn't have said that because I didn't appreciate just how much it does make a difference to staff. Because sometimes you think staff can be quite complacent, or it's just for the Trust Board, or it's just for them at HQ or whatever, especially when you've got 80+ spaces, but staff actually have engaged it. We've had some fantastic experiences with the trophy on tour, we've had some fantastic feedback, and I think it has made a difference, and it has given them a boost to the work that they do and the tough jobs in the NHS. And it's been a tough winter, etc, etc. So I think it really has given them that extra bit of life and what have you. So absolutely, any reservations, come and speak to me, but honestly, just go for it. It's really worth it.